Hello, my name is Dr. Shelley Sommerfeldt, psychologist with the Loving Roots Project, and today I wanted to discuss some self-help strategies for managing depression. Major depression is a serious illness that may require intensive treatment through psychotherapy or medication. But many people find supplementing their treatment with self-help strategies can be very beneficial. First, what are some symptoms of depression that people may experience? Well, they may include feeling down, a depressed or sad mood, feeling hopeless, diminished or lower interest in activities, significant weight gain or weight loss, oversleeping or an inability to sleep, psychomotor agitation, fatigue, or loss of energy, feelings of worthlessness or guilt, a diminished ability to concentrate, feeling indecisive, or reoccurring thoughts of death. Now, here are 10 tips for managing depressed mood. Number 1, good nutrition. It comes as no surprise, but there's a strong link between healthy eating, good nutrition, and mental health. That mind-body connection, as we know, is so strong, and therefore taking care of your body also helps in taking care of your mind. This means eating healthy, whole foods and cutting out processed, sugary, and refined carbs. This can help improve your mood. It also is important to manage caffeine and alcohol intake, especially when you're feeling depressed, because both of these substances can play a direct role on mental and emotional well-being. And number 2, journaling. The act of writing is a method to process emotions by describing how you're feeling. Processing of feelings is essential to the management of emotions. Journaling provides an outlet to express your feelings in a safe and non-judgmental state. One specific example of journaling that may be helpful is a gratitude practice. By journaling each day on something or several things that you feel grateful for, you can shift your mindset into something more positive, which can improve your mood and reduce depression. It sort of forces you to think in a positive way. And when you're feeling depressed, that can be very difficult to do. Number 3, exercise and physical activities. Trying to get more physically active can be very beneficial during times of depression. It is often the opposite of what someone feels like doing when they're depressed, but there's a lot of research that shows the benefits of exercise, that they can increase endorphins and other chemicals in the brain during physical activity, which will directly combat depression. So try and push yourself to maybe go for a quick walk several times a week. And number 4, social support. It can be helpful to talk and express your feelings with others. Be sure to surround yourself with positive and healthy people. Having meaningful, connected relationships, they're important in times of need and support. And number 5, mindfulness. Engaging in mindfulness meditation can serve as a key element in managing depressed and difficult moods. Mindfulness is the practice of being fully present and aware in the moment to how you're feeling, what you're thinking, and your emotional state. It allows you to calm yourself through breathing in a meditative state, to be very aware of your emotions and your feelings. This is important during a depressive episode because emotions can be overwhelming and very stressful. This is especially true if you're finding yourself obsessing over your thoughts that may be negative or controlling your mind or your mood. So take a few minutes each day to implement a mindfulness practice to allow you to calm your thoughts, your mind, and better manage your mood. And number 6, outdoor activities in sunshine and fresh air. So get moving and get outside. The research shows that being outdoors and surrounding yourself with nature can actually be helpful in uplifting of moods. As we already know, that physical activity can be helpful, but so is getting sunshine. Spending time outside and in the sun has been found to be effective in combating depression, especially if someone is dealing with a seasonal depression, which occurs more often in the cold, darker winter months. And number 7, keep stress down. Managing of life's stressors is important for overall coping. Many of the same coping skills that people use and find effective that keep stress levels down, they also play an important role in reducing depression. So when someone is struggling with depression, they can also feel overwhelmed and stressed out. Implementing coping strategies that focus on relaxation and management of stress can also help with depression. And number 8, hobbies and happiness activities. When we're feeling down, it's important to try to find activities to stay engaged in. Many people may want to isolate and stay home and not do anything, and that can actually be more detrimental. It can be helpful as a distraction to engage in activities, and it also gets you physically and mentally active, depending on the activity. It can help you to express emotions and boost feelings of happiness. So be sure to look for something new and engaging, a new hobby or an everyday activity that could bring you enjoyment. Again, it's common that when someone's feeling depressed, they don't want to engage in anything. But just remember, it's actually these activities that can help you with managing your depressed mood. And number 9, reduce negative thinking. While this is incredibly challenging to do, especially if you're feeling depressed, it does play an important role in managing mood. The power of positive thinking can have such strong positive outcomes in essentially reducing depression. There are several techniques which can help to boost positive thoughts, including keeping mood journals. So tracking how you're feeling, tracking and altering negative thinking, positive thinking apps, and just engaging in daily affirmations. Affirmations are a simple technique to say positive things to yourself, which will help to increase the positivity in your thought process and the way that you think. This means starting each day with saying things to yourself like, I can do this. I am strong. I deserve to be happy. And lastly, number 10, seek professional help. Major depressive disorder is a very real and can be difficult condition. Although this video is about example self-help strategies to manage depression, it's important to point out that for many people, self-help strategies will not be as effective as medical treatment. Many people often need a jump start to fighting their depression by either seeking psychotherapy or using medication or both. This is especially true if you've ever had thoughts of suicide. Seeking treatment is essential. In that case, if you're thinking about suicide, you can call 911, speak to your healthcare provider about your options, or call a 1-800-SUICIDE hotline. There are also many places that you can find psychologists in your area. There are online directories, or you can check out websites such as depression.org for more information. So last, I'll leave you with the National Suicide Prevention Lifeline, and that number is 1-800-273-8255. Thank you.